We have to remember that hearing is a blessing, and it allows us to be part of our world and experience and enjoy life. And without taking proper care of it, things can happen. So for example, after something
So we obviously do medical management, we do ancillary testing like allergy testing, CT scans in our office as well. We provide nasal endoscopy. We have hearing, looking at the septum here, the turbinates, and this is a cross-sectional view, looking at the tongue. All of these things can contribute to problems with sleep if you have a large tongue, if you have large... Well, I think one of the big things that's different about men is sometimes they're often a little bit reluctant to share their concerns. Sometimes they're a little more, they don't want to go to the doctor as much. Men and young boys, they're afraid to really talk about skin care just because there's a stigma surrounding it that's often a little negative, so they don't want to talk about it, they don't want to ask. Sometimes people really don't know exactly what they want done. They just want to look refreshed, they want to feel fresher looking, they want to look younger. But it's up to us to tell them where the key areas. This is the first filler that lasts about 2 years, so it's wonderful. It has this new Vicross technology, which basically allows it to flow easier through the syringe. We can use Sometimes people are just told it's allergies, but it may not always just be allergies. It could be a deviated septum, it could be polyps, it could be vasomotor rhinitis, it could be a lot of different things. What I love about my field is that we treat so many different varieties of symptoms, from hearing loss to hoarseness to sinus problems, allergies, thyroid disorders, dizziness. We specialize in all ENT issues, so obviously we deal with, the head and neck, anything in the head and neck. So hearing loss, hoarseness, thyroid disorders, neck masses, all of the above. And by lifting the cheek area, not only can we add that three-dimensional youthful balance back to your face, it also helps rejuvenate the eye area and also helps take pressure off this area. What happens is when we lose volume in our cheek area, it flattens our appearance and it makes our face go from more of an oval, attractive shape to a little more of a square, flat shape.
Hi, I'm Dr. Kalpana Depasquale, a board-certified ENT physician and facial plastic surgeon. So many of us buy products hoping to solve a skincare concern that we have. We first head to the drugstore, the department store, or search online to find a solution. We use the products that sound like they will work, but when they don't, they go into our product graveyard. When you read the ingredients, you can't even pronounce the words, so you know they're full of chemicals that you may not want to put on your skin. You eat right and exercise to take care of the inside of your body. But what about the largest organ of your body, the skin? Taking care of your skin is imperative for full body health. I've experienced this firsthand. I've used products that either didn't work or made my skin react because of the harsh chemicals. Apparently, my skin is sensitive to chemicals. When I looked for an effective, natural brand of skincare, I couldn't find anything that suited my needs. But with Avanti RX, our products uniquely contain botanical ingredients, effective ingredients, a pleasant consistency, and only natural fragrances. That is why I created Avanti RX. Our products are made in the USA, they're not tested on animals. They are paraben-free, sulfate-free, fragrance-free, and gluten-free. They are also free of harsh chemicals and toxic ingredients. I'm Dr. Depasquale, and remember, with Avanti RX, your skincare regimen can be tailored to fit your busy lifestyle. I'm Dr. Depasquale, a board-certified ENT physician and facial plastic surgeon. Have you had blemishes that leave you feeling less confident? Have you tried skincare products that leave your skin feeling irritated or dry? The first step to clearly luminous skin is our Avanti RX Clearly Luminous Cleanser, which contains botanical ingredients like daisy flower extracts, flower acids, and totol for antibacterial, antioxidant properties, in addition to 2% salicylic acid to combat tough blemishes. This product can be used once or twice daily and is safe and effective enough for teenagers who suffer from blemishes all the way to hormonal breakouts as an adult. I'm Dr. Depasquale, and remember, with Avanti RX, your skincare regimen can be tailored to fit your busy lifestyle. I'm Dr. Depasquale, a board-certified ENT physician, facial plastic surgeon, and the founder of Avanti RX. The second step of our Clearly Luminous regimen is a luminous hydrating toner. It is designed to plump the skin with hyaluronic acid and moisturize with D2O, heavy water. It doesn't contain any oils that may clog your pores. I'm Dr. Depasquale, and remember, with Avanti RX, your skincare regimen can be tailored to fit your busy lifestyle. I'm Dr. Depasquale, a board-certified ENT physician, facial plastic surgeon, and the founder of Avanti RX. The third step to the Luminous regimen is the Clearly Luminous Serum. This lightweight serum is designed to moisturize without leaving a residue. Plus, it minimizes shine while providing essential antibacterial and antioxidants to the skin, while preventing new blemishes. Clearly Luminous Serum can also be used as a daily moisturizer for those who want supple skin with a lightweight serum. I'm Dr. Depasquale, and remember, with Avanti RX, your skincare regimen can be customized to fit your busy lifestyle. I'm Dr. Depasquale, a board-certified ENT physician, facial plastic surgeon, and the founder of Avanti RX. As we get older, sun exposure and the aging process can lead to dark areas on the face called hyperpigmentation, or age spots. Most people that want to eliminate these age spots are recommended a hydroquinone cream to lighten these unsightly spots. Why use chemicals such as hydroquinone when you can lighten age spots using botanicals like Sim White and Alga White found in Age Spot Remedy Serum? This serum can be used safely once or twice a day to minimize the appearance of age spots and help you look younger. I'm Dr. Depasquale, and remember, with Avanti RX, your skincare regimen can be tailored to fit your busy lifestyle. Acne can affect adults as well as teens. The important thing to know about acne is that there are some alternative treatments that many people will not discuss with you. As we approach our mid to late 30s, many of us will start to see some lines creeping up on our forehead, between our eyebrows, and also around the eye area, the crow's feet area. We don't like those lines because those lines make us feel older, make us look angry, make us look sad. The lines are easy to get rid of with a product such as Botox, Xeomin, or Dysport. Do you have Afrin bottles stashed everywhere in your house? Are you afraid to leave the house without your Afrin? If this is the case, you suffer from a condition called rhinitis medicamentosa. People often ask me how to stay young and age gracefully. Here are a few tips for you. Number 1, avoid sun exposure as much as possible. The harmful rays of the sun will certainly age you a lot faster than if you use sun protection and a nice wide brimmed hat. Diet and exercise are also extremely important in staying young appearing and looking healthy. Exercise stimulates blood flow, and obviously your diet impacts your skin from the inside out. Do you suffer from sinus pressure, headaches, thick postnasal drip, or nasal congestion? Have you seen a doctor that told you that there was nothing that can be done? Well, think again. Smoking ages you significantly. If you compare people that don't smoke to those that do, they look on the average of 10 to 15 years older. As an ENT physician, I encounter earwax on a regular basis, and one of the things people hate the most is earwax. But surprisingly, earwax is very necessary. It actually functions to lubricate the ear canal and also collect debris that could go into your ear canal. They say the eyes are the windows to the soul, but often our eyes are what give away our age the quickest. As we get older, the thin skin underneath the eye starts to develop some crepiness, dark circles, and also you can develop crow's feet around the lateral edge of your eye. The first step to start with would be a good eye cream. Eye creams should have ingredients such as retinol, haloxyl for the dark circles, or even vitamin K. As we get older, our eyesight tends to decrease and our hearing tends to diminish. The funny thing is that most people don't have a problem wearing glasses when they can't see, but somehow they really have a problem wearing a hearing aid when they can't hear. The biggest issue, they say, is because it makes them look and seem old. But what they don't realize is that asking people to repeat themselves, I'm sorry, I didn't hear you, can also make you sound a little older. How do you know if you have a cold or a sinus infection? The difference lies in the duration of the symptoms as well as the severity of the symptoms. A common cold will usually last a few days to a week. Typically, you're getting better each day and you're feeling a little bit better with antihistamines and nasal sprays and Sudafed. A sinus infection, on the other hand, typically you feel worse with every day and the symptoms will last longer, anywhere from 10 days or longer. A sinus infection will usually require antibiotics. If you can't tell the difference between the two, it's important to visit your doctor so that you can have proper treatment. This is Dr. Depasquale. Thanks for watching. As we get older, many of us are looking for a way to just feel a little more refreshed and look a little well-rested. But unfortunately, so many of us have seen too many celebrities in the media that have had way too much done, and they wind up looking unnatural. What this does is it makes us afraid to have anything done. At Avanti Medical Spa, our goal is to have you look natural but be glamorous with little to no downtime. Thank you for watching. This is Dr. Depasquale. I see sinus patients on a regular basis in my office. The first line of treatment for these patients is medical therapy, but when medical therapy has been ineffective, surgery must be considered as an option. It's often very interesting to me how many misconceptions people have about sinus surgery. Almost everybody knows somebody who has had sinus surgery and they bring their horror stories with them. These days, sinus surgery isn't what it was 20, 30, 40 years ago. The technology is advanced, we have better scopes, we have image-guided systems. Tinnitus is an abnormal noise or ringing in the ear that affects 1 in 5 people in the United States. The first question that patients ask me when they have tinnitus is it curable? Unfortunately, in most cases, it's not curable, but that doesn't mean that we can't find something to make the situation more comfortable for you. If you've ever had dizziness or vertigo, you know that it can be often debilitating. If you've had this problem, you've often seen a doctor that's prescribed medication for you, and then they tell you that your diagnosis is vertigo. Well, it'll be important for you to know that vertigo is a symptom and not a diagnosis. I have an eye cream that actually works on reducing the dark circles and also improving the texture of the fine lines underneath the eyes. One of the biggest mistakes is that people do not apply enough sunscreen to be effective. The minimum is about a shot glass, so I have 3 different shot glasses here to demonstrate.
Dr. Kalpana Depasquale now performs balloon sinuplasty in her St. Augustine office and says for most patients, it's a one-time fix.
The balloon is actually passed in through the nose using what we call a guide. The guide is just what harbors the actual balloon.
After treating the symptoms with minimal success, Dr. Depasquale suggested a minimally invasive in-office procedure called balloon sinuplasty.
Where do you feel the pressure?
Where I guess the balloon is right now.
Okay. The majority will feel improvement within about a week, and they can get back to their lifestyle. They're not on as many medications. They don't have as many sinus infections. They generally have a better sense of well-being. There is a genetic predisposition to acne, but the other factors can also be obviously hormonal, which is a big issue amongst our adolescents, and sometimes it could be the products they're using could be contributing to acne, so it's usually multifactorial.
The other big mistake people make is they think that on a day that it's cloudy, we don't need to wear sunscreen, and that's not true. 80% of the sun's rays still travel through the clouds, and also people need to wear sunscreen while traveling in a car, believe it or not.
And even if it says waterproof, when you come back out of the water, reapply?
You have to reapply. Most of the sunscreens these days will have something on the label that will tell you how often you need to reapply, how long it's water resistant for. But if it doesn't say, because some of the labels are not up to date, if it doesn't say, a good rule of thumb is about 2 hours before you need to reapply.
Now, we've been conditioned to respond to certain brand name sunscreens, but it's not always the name that's going to give you the best protection. In fact, I think there was a study by Consumer Reports, and they found that some of the off-brands actually provide better protection.
That is absolutely true. One of the most common ingredients in most of the sunscreens is avobenzene, and that's what they use as a sun protectant. But there are other brands of sunscreen that will contain ingredients like titanium dioxide or zinc oxide, and those are actually very effective, and they're mineral-based, so they tend to be a little safer and not so much chemical-based.
And we don't always cover all of our body as we should. I mean, we think about the face and the torso, but things like your ears and other parts of the body need to be covered as well.
Absolutely. The ears are very common. As an ENT surgeon, I definitely remove my fair share of ear cancers for people who do not think about the ear being exposed. I've been in practice about 11 years, and we had many different cosmeceutical lines that we had in the practice, and people always express concerns about, I read these ingredients, I'm not sure about this, I'm not sure if I want to put this on my skin. And I heard those concerns, and they started to really become concerns of mine. And so as I started looking more into the chemicals that were in these products, I started to get concerned about the long-term effects of these chemicals. And that was where I decided to create my own skincare line, because there's nothing available that's just botanicals.